Welcome to Hypnotic Talk with Miri and Neota, where we discuss all things hypnosis. Our individual practices have evolved into different specialties over the years, but we have remained connected through our mutual love of hypnotic healing. So we meet here and we share our knowledge and our stories from our individual professional practices. Hi, Miri.
Hi. Hi, Neota. So today we are talking about stories.
Well, we're still talking about managing the magic expectations of hypnotherapy. But this week we decided that we would share some of our practice client results and side effects that that we have worked with or ourselves have experienced as a result of hypnotherapy.
So let's start with the word side effects, because it sounds pretty scary.
That is true. And I love to use it because as clinical hypnotherapists, we'd like to work with people to overcome their, medical issues, like to be a supplement or to be assisting or help people overcome those things. Or sometimes they'll have a blockage. They just can't find what they have been trying to resolve in the medical field. And both of us are on the same page. You have to have a medical diagnosis. Western medicine is imperfect, as is all medicine, but it's important. And we can't help people until they have consulted with their physicians. Absolutely. Having said that, hypnotherapy is a phenomenal complement. So in my life, I don't like to use medication except as a last result. Medication has its place, but in my life, I use it as a last resort.
Same.
I will try everything. I will try nutritional tweaks, or, I will go, exercise. I will go through everything I can to avoid medicine. And the reason is because no medication comes without a side effect. And some of those side effects, like insomnia medication, insomnia is a side effect.
Yeah. And we say that everything basically can be considered a side effect, right?
Yes, that's right.
If we're not treating the real issue, the root cause.
Exactly. And the side effects of hypnosis are inner peace, better sleep, but ability to remain calm in stressful situations. It's like, go ahead.
So I'll be a party pooper and say that, this is it might be some of the side effects, like all the calm and the relaxation and being grounded and centered. But we might, or some clients might experience some not very, but we can take the clients out of their, balance that they have at that moment.
You're right.
And then it will create some kind of discomfort in order to get to the comfortable side of it.
That is true, because sometimes when you have festering trauma that is presenting as something else, it's presenting as insomnia or pain. Absolutely. So to resolve the issue, we access the trauma to release it. But in the process, we do shake it up. And there can be some tumultuous, events that are like feelings around it as it's on its way to healing. It's like how a scratch will get itchiest right before it's completely healed. So yes, that is correct. You're right, Miri. I'm glad that you addressed that.
But overall, like for me, I see those, inconvenience of the side effect, mostly with clients who come for chronic pain. But with those who come for anxiety or sleep issues, I hardly see any of the negative side effects. I mostly see the positive side effects, and this is what we're going to talk about today. When you said side effects, you meant that kind of side effects.
I did mean that kind of side effects. And another thing just about being, if there is sometimes some tumultuous responses in the interim, that still signifies change. It still signifies that things are moving, things are being addressed. So it, even though it might have a short-term negative effect, it still has a positive expectation that you're doing the right thing, even if it's uncomfortable for a few minutes.
And I compare it to, you know, when you start running or when you start doing any type of physical exercise, at the beginning, you have muscle cramps sometimes.
Right.
Or, you know, some discomfort after that, or you feel very weak, or you feel, you know, extremely tired. But this is how we build ourselves if we continue with that. And the next time, maybe it will be less and less and less and less until we feel we can go further. We are stronger and we can do much more.
Good analogy, Miri. Very good analogy. I like that. So,
so let's talk
tell
about
some stories.
Yeah, some of the stories. You want to go first?
So, you know, I'm going to keep my clients entirely confidential, names and any identifying factors, but these are true stories. And the first one is a youth that had been at the Children's Hospital for 18 months, seeing a neurologist for something called viral headache syndrome. So what that is it's actually quite a common thing, even though I had never heard of it at the time, but it is when the human body has experienced a severe illness, like meningitis or mono, like a very severe virus. It activates its immune system and it goes into fight mode, and it's fighting the virus and it's fighting the virus. And when the virus has gone, sometimes the body doesn't recognize that the virus is gone and it continues to fight, which is, of course, activating all of these things. And a result of that can be viral headache syndrome. And so this client of mine had a headache for 18 months.
Wow.
Yeah. They couldn't participate in sports. They could barely make it to school. And if they did make it to school, they were done because that's all they could tolerate. And they were seeing the neurologist. They had exhausted so many different things. They had tried every possible treatment plan that the neurologist could come up with. They had tried some exploratory or like experimental. At one point, the child had an IV in and they would go get regular steroids. And out of sheer desperation, the mom contacted me and they came to my office. And at the conclusion of our first session, went out in the waiting room, the child said that the pain had gone from like the regular 8, where it hovered around out of 10, it went down to a 4, which they hadn't experienced for some time. And that was such a relief. And the parents were so relieved, and it was just wonderful. And I did a follow-up in the morning, and the child had a sleep-in because they hadn't been sleeping for 18 months. And when they finally woke up, they were headache-free. Wow. It was miraculous. The mom was crying, I was crying, the child was crying. It was such a relief. It was such a relief. And so, you know, we did a couple more sessions just to, you know, cement it, but it was so rewarding, so rewarding. Yes. And the neurologist was I think the mom had called the neurologist and said, what do you think? And the neurologist said, do what works. Do what works. No harm can come from it, you know? So they came to me, and it was amazing.
It's amazing because being pain-free and getting the neurologist acknowledgement for that, everything is okay and you're just pain-free. It's amazing.
Yes.
So
Tell me
along
one
this
of your
story,
stories.
along this story, I have another one. Not about headache, but client who had wart, like really huge wart on her toe, and
Right.
it was keep growing. And for 3 years, every 2 weeks, she went to the doctor to burn this, and nothing helped. And
Wow.
the wart was keep growing, growing, growing. And we did some processes, and she was able to say when the wart will disappear. And after 1.5 months, that nothing else was done but these couple sessions of hypnosis, the wart was gone. And she was very excited to go to the doctor and to show the doctor the results, her clean, smooth toe that she has.
Amazing.
So she went to the doctor, and the doctor said, "So how did you do it?" And said, "Oh, just hypnosis." And the doctor was saying to her something like this, that he knows how powerful is the mind. He never saw a wart being disappeared so cleanly and clearly from a toe. So he was like, she was so, so pumped and
Yeah.
motivated now to use hypnosis and everything else, and
Yes.
hopefully he will be too. But this was one, and the other one was um, a client who I worked with before knee replacement
Right.
surgery, and it was a mix of anxiety and pain. The anxiety came because she didn't know what's going to happen during the surgery and even after, and
Right.
also because there was no date for the surgery. They never
Right.
gave her a date, so it was postponed a few times, and then it's like she felt like it's never going to happen, and what happens with her, and
Yeah.
so on. And the pain, of course, it was really hard for her to walk and to do any kind of activity, and she was very active, any kind of activity that she used to do. So for her it
Right.
was the pain, anxiety, and the she told me that she's lacking the ability to relax.
Right.
So
Oh, yeah, of course. Like it's so prevalent in everything in her life.
absolutely. So we had to work around all of this. And then finally she got the, when I say we had to work around all of this, it wasn't like too many sessions. I think it was like 2 sessions that she got so many good feedback about how she can relax. And she said that her anxiety is dissipating and she can just put it aside, and maybe later she will look at it, but she never got back to it. And the pain
Right.
was now bearable. And of course, it was done with her acknowledgement of with the acknowledgement of her doctor. And when she
Yeah.
got the date for the surgery, we did one just for the surgery, just as a preparation for the surgery. Then the surgery went amazingly well, and the knee was replaced, and she got back on her feet in like speeding time, and she's now walking like she got back to walk 10,000 steps a day really, really quickly, like much more quickly
Wow.
than they anticipated. So this one is another one that, it's not instead of anything, and it
No.
needs to have, like, we need to get a diagnosis.
Yeah.
Um, but it's like it's improving the life of the person that we work with.
Yeah. Yeah. Like I have another client who so I have a client who I was seeing for some stuff, and then her son is a professional singer, and he developed a stutter, but the opposite of other people. Lots of people can sing without a stutter, but talk with a
Right.
stutter. His was the reverse. He could talk no problem, but he started stuttering when he was trying to sing. And he's a professional singer, so it was,
Wow.
a bit of a
Yeah.
hindrance. And so his mom said, I want you to try hypnotherapy. And he said, nope, I have no desire to do your voodoo stuff. I'm not interested. In the meantime, he was seeing like stuttering, worldwide stuttering therapists, the experts in the world. He was seeing somebody in France. He ended up on a prescription for like an anti-anxiety, and it worked, but he didn't like the feeling of it. He didn't like being checked out. And so under complete desperation, because he had tried every other thing, literally, he's like, fine, I'll talk to your hypnotherapist. So he messaged me, and she messaged me, and she said, please reach out to him, but do it straight away because he's really reluctant. Don't let him change his mind. So sure enough, I messaged him, and we had a consultation, and I said, it's encouraging that the medication gave you the result that you wanted, because that means it can happen. You physically can be without a stutter. And if you can do it with medication, I can do that for you. So let's get it booked. And he completely bought into it because of my confidence. That was the only reason that he decided to give it a shot. So we do the session, and he didn't do any follow-up with me or anything. And then all of a sudden, 2 days later, I got a voice message, and it was him singing. It was him singing, and it was the most beautiful thing. And now we meet all the time, because he's like, what else can you fix me with? And then he's like, oh, I hate flying. It takes me 24 hours to get over the anxiety after I fly. The cortisol just pumps through me for 24 hours. I'm like, of course I can fix it. Like, why do you doubt me? So we did a session about his fear of flying. And then he sent me a message, and he's like, he's so wonderful. He's like, I don't know how the F you did it. You didn't even mention flying, and now I'm fine. Like, he's like, I don't know why I didn't believe you. So it's just so great. I love my clients. I love all of my clients. I have a client with who had suffered from OCD her entire life, like compulsions, tapping. And she had worked on it in so many different ways, behavioral therapy and medication. And we were able to clear up her compulsion in one session. And I still see her for other things. Life is an ongoing thing. We're all works in progress. But her sister came to me shortly afterwards for something. And when we were doing our consultation, she cried, and she said, I've never known my sister to not tap her toothbrush. Wow. Like, in our lifetime, I've never known it. And this is a full-grown woman, going towards middle age. And it's just so, wow. It's so wonderful. I love it. I love it so much.
Yeah, it's amazing. I had a client coming in for stop smoking, and within one session he stopped smoking, and then he brought, like, his son. He referred his wife to come, and she came for something completely different, and for weight loss. And it's amazing how it's like, one person is doing it and enjoying it and refers some other to enjoy it too. Had a client who came because every time she was in a conflict, she felt like she has a lump in her throat and she can't speak. And again, we did like a process, and the next message I got from her after a couple of days, that she had a conflict with her boyfriend, and it's like she's throwing up all the words out, and she can't even recognize herself.
Her boyfriend was probably like, thanks.
Yeah, like, what's going on here? Same with, with public speaking, right? And now with Zoom, it's not even different, because people are being a bit more cautious to talk in Zoom calls. So Zoom didn't resolve the public speaking issues, but Zoom's the same. Someone came to me and she was unable to speak during, in a room full of people, and then COVID started, and she thought, okay, it will be okay because we're on Zoom now and it will be much easier. I don't have to look at them. But sure enough, 20
Same
people are
issue.
looking at her through the screen, and she needs to talk and she can't talk. And again, we did a process, and for her, it wasn't like spontaneously done, but it was after 2 or 3 sessions, I can't remember.
Yeah.
She was able to speak clearly and deliver a concise message and speak in a way that she felt confident enough, and she was able to deliver the message.
Yeah.
So, what else do we want, right?
Right. And like I've had other clients who have contacted me or shared with me that they enjoy the hypnosis and the outcome that we create, but their families love how calm and relaxed they can be after a session. Like the one lady, her husband worked away, and he would be coming home, after being away for 3 weeks or a month, and then he would say, "Are you going to see that hypnotherapist before I come?" Because just it's like when you go to the spa or on vacation and just get that full reset where you just have more tolerance, you have more patience, and things are just a little more easy to deal with.
It's
Just a
funny
side
that you
effect.
say it. I had a client who came for anxiety, and she had full-on anxiety, panic attacks, and like throughout the day,
Yeah.
numerous of them. And
Yeah.
after that, it wasn't on one session, but it
Yeah.
was a process. I think like we completed 4 sessions, but it was before the 4 sessions that she says she feels like she's taking CBD oil, and she feels so calm.
Yeah.
But for her, it was after the first session, it wasn't number of panic attacks every day. It was 1 or 2, but she came and she was quite disappointed. She said, I still have 1 or 2 panic attacks every day. And said, okay, but what happened before that? How many did you have? Said, oh no, before that I had like 10, 12, but now I still have 2. So, okay, we can work on those too. But there is an improvement here.
Yeah.
So
It's not entirely magic. It works a bit
yeah,
like magic, but it's not entirely magic.
exactly,
There's still
exactly.
a process. There's still things
Yeah.
to, yeah, the nature
So
of it.
yeah, so with that, we both, Neota and I, would like to thank everyone for staying with us, and we'd love to hear from you any hypnotic questions that you have. Just let us know, and of course we'll get back to you. And we hope that this discussion was interesting for you and tickled a part of your curiosity for you to learn more and come back to visit with us. So until next time, bye-bye.
Bye, everyone.
Bye.